Now, let's welcome Dr. Ryan Jordanhazy, the Emergency Department Medical Director at Novant Health Brunswick Medical Center. Dr. Jordanhazy, it's such a pleasure to have you here today. I'm really excited to learn about you, and I know our viewers out there will be very interested. So let's start with your background. Tell me a little bit about yourself.
Yeah, sure, no problem. I'm excited to be here as well. Thank you, June.
Great.
Basically, my name is Ryan Jordanhazy. I'm an ER doctor, the medical director at Brunswick Medical Center ER. I'm born and raised in Pittsburgh, Pennsylvania, which is where I grew up, went to high school and undergrad. I went to medical school at Wake Forest University in Winston-Salem.
Well, that's neat.
Which at the time is where I met my wife, my future wife, I should say. We ultimately have been living in Winston-Salem for the past few years. We had a baby boy about 10 months ago named Palmer. And just a few months ago, we moved to Wilmington when I got this job here at Brunswick.
Yeah, how are you liking Wilmington?
It's nice. We love it. We had some family in the area, which makes things great. And we'd already been here a handful of times to visit, so we figured, why not live where you vacation?
That's neat.
Yeah.
And Palmer, what a cute name.
Yeah, he's something special.
Well, that's great. We're happy to have you here. Tell me, what brought you to ER medicine? What interested you in that?
Yeah, it's always a tough question to answer. Growing up, I always had a bit of interest in it. My mom was an ER nurse, so I got exposed to it when I was really young, and then sort of growing up, I knew I wanted to be a doctor.
Sure.
So I spent some time in the ER. I volunteered in high school, worked as a tech when I was in college.
Really?
Yeah, and then through medical school, you sort of rotate through everything.
Yeah.
And it just seemed like a good fit. I like the pace, I like the...
It's a fast one, huh?
Yeah, the variety. The hours are pretty good usually. And
even at night?
Yeah. Well, sometimes at night you see the more exciting and more crazy things.
Well,
so
that's true.
Yeah, so overall it seemed like a good fit, and I'm really glad I picked it because
that's
it's led me here.
Yeah. Well, you mentioned that you're the medical director at the Novant Health Brunswick Medical Center Emergency Department. Tell me what that entails.
Yeah,
as medical director.
Yeah, sure. The vast majority of my time is still just clinical, just like anyone else that works there. I spend my time working my shifts, seeing the patients that come in.
Okay.
And then on the medical director side, it comes with, as you might guess, some more administrative roles. I deal with scheduling, recruiting. I meet with the hospital administration to make sure that everything is running smoothly. We work through improvement protocols and processes to make sure our throughput is meeting benchmarks, make sure all the national benchmarks in terms of stroke care, heart attack care, sepsis care are being met, and figuring out ways to improve on that end.
And do you find yourself having to have discussions with families if there's a problem or they're not?
Yeah, that's a big part of the job too, is dealing with the patient grievances or complaints.
I'm sure you don't have too many of those.
No,
but
we actually do really great at Brunswick, but anyone that has any sort of issues or concerns, that'll come to me and I'll make sure that we address them.
Well, that's awesome. So other than yourself, how many providers are there in the emergency department at Brunswick?
So we have a good core of 10 providers, 5 full-time docs and 5 full-time PAs and NPs, APCs, if you will, and then a handful of part-timers and PRN people that live in the area. We're now luckily at the point where we don't have any travel docs or travel PAs. They're all sort of members of the community.
So the 5 physicians that you currently have, they live in the community or in the surrounding community?
Yeah, I mean, a lot of them are born and raised, Southport, Shallow, Wilmington, things like that.
Dr. Sherrod, we've had
exactly.
him on our show quite a few times, and I know he grew up in Southport.
Yeah, he's a really well-established, everyone knows
everybody
him,
knows
so
Bill.
he's a great asset to the team.
Well, let's talk a little bit about what it takes to be a physician in the emergency department. Tell me about their experiences or their credentials.
Right. One good thing and one really nice sort of service that we offer is that all of our physicians are board certified in emergency medicine.
And that's very important,
Yeah,
isn't
definitely. Because, well, depending which ER, not every ER you go to will have a board certified physician, and ours 24/7 we'll have a board certified physician there waiting, ready to handle anything. So they've been trained specifically in emergency medicine.
Yeah, that's very important because I have been in emergency departments in the past, well, not here, and the physicians were not emergency trained physicians. They were just locum tenens or
Right.
another service.
Yeah, some places have to make do with what they
Sure.
with what they can, but us, we luckily don't have that problem. We have all board certified.
That's great. Yeah. Well, I know the name of your group is Apollo MD, correct?
Correct.
And so tell us a little bit about the relationship you have with Novant Health.
Okay. Yeah, Apollo MD is basically a nationwide medical company, medical staffing company that provides staffing services basically to hospitals nationwide. Recently, they have come into a partnership with Novant Health, mainly on the ER side. So they have a deal with Novant to provide ER coverage for 4 hospitals in the area, or in the state, I should say. Kernersville and Clemens, which is out by Winston-Salem, Thomasville ER, and then also Brunswick here. And that relationship started earlier this year.
So you say it's nationwide, so it's all over the United States, Apollo MD?
Yeah, pretty much. I mean,
Really?
I think it's centered mainly around the Southeast, Georgia, North Carolina, but they are staffing over 100 hospitals nationwide.
Wow, that's a lot.
Yeah, it's a pretty big company.
Yeah. So it sounds like there's a lot of experience within Apollo MD. I mean, there's a lot of physicians who've done this for years.
Yeah, I mean, it's a physician-owned, physician-led company, and it's been
Nice.
around for over 30 years.
Oh, that's great.
And one nice thing is, you know, even the president of the hospital, or I mean, president of the company, sorry, or
Right.
CEO of the company, they're physicians and they work in
Really?
the ER just like everyone else.
Wow.
Yeah.
You said in addition to being the medical director, you staff too. You
Right,
are a
of course.
physician,
Yeah,
a working
naturally.
physician
Yeah.
in that.
Which is nice for Apollo because the same
Right.
thing can be said for the highest up CEO or president. You know, they're also working in the ER, so they know what it's like. In fact, Dr. Patan and Dr. Patel, which is the president and regional director of the company, they've all worked shifts here at Brunswick, and they have nothing but good things to say about it.
Yeah.
So,
So the bosses work too.
yeah, exactly.
Right. Well, I know that we recently entered into a partnership with New Hanover Regional Medical Center to provide AirLink services to us
Right.
through the AirLink company. Some of our viewers may not know about that. Let's talk a little bit about that service.
Okay, sure. Yeah, AirLink basically, to break it down simply, is a helicopter service that
Right.
transports patients to where they need to be. So we actually have a helicopter based at Brunswick Hospital ER, where if there's anything emergent or life-threatening, that time is of essence and they need to get somewhere to basically save their life, we don't have to have them ride in an ambulance, which obviously can
Yeah.
be multiple delays depending on the time and situation. We have the luxury of having that helicopter there to transport. And right now there's available, I guess you could say, 12 hours a day, with plans here in the near future to have it 24/7, which will be a good sort of service
yeah,
for
I
the
understand
community.
they're going to extend those hours.
Yeah, certain things. I mean, you might imagine like if you're having a major heart attack or
Exactly,
some
or stroke
catastrophic illness or injury that you need to get somewhere
Right,
fast.
right.
You don't want to have to wait around for transportation.
And I believe that they often will go to the scene of an accident
Oh,
or
yeah,
what have you
definitely.
and pick that patient up.
Yeah. So sometimes they'll bypass us. You know, if they
Yeah.
get called to a bad car accident or something, they
Right.
land the helicopter in the field
Yeah.
and just take them and go.
Yeah. I know that sometimes people can't decide whether to go to the emergency department or a critical access
care
or
or
urgent
something,
care
yeah.
or something like that. When do you recommend you come straight to the emergency room?
Yeah, that's always
That's
sort
a
of a
tough
tough
one.
question
Yeah.
because we don't want to ever, so we see everyone, anyone who shows up, we're glad to
Sure.
see you. Sometimes you might be better off, sir, for your personal financial reasons to go to an urgent care.
But if in doubt, you probably
Anytime
should
in
come to
doubt,
the-
and anything, you know,
Yeah.
chest pain or
Right.
shortness of breath or any major injury, if you show up to an urgent care, they're probably going to send you our way anyway.
True. Yeah,
So if you're ever
Right.
sort of on the fence, I would say definitely err towards the side of coming to the ER.
Well, great. Well, it's been a pleasure to have you on the show. And what a great addition to Novant Health
Yeah, I'm
Brunswick
happy
Medical
to-
Center.
happy
We're
to be
happy to
here.
have you here. And
Yeah.
we hope to have you back real soon, and we'll see how things are going.
Yeah,
I
no
heard there's a
problem.
lot of new things going on at Brunswick.
Yeah,
so
we're really excited about the opportunities to expand and continue to serve the community.
wonderful.
Yeah, thanks
well,
so
thank
much.
you again for being here.
Yeah, thank you.